Good morning. All righty. Good morning. Oh, well, I'm being told to hold my close. Is that better?
Yeah.
Okay, so I'm sorry about that. Good morning, everybody. My name is Dr. Tanya Bracho Ashley, and we're at the New Jersey COVID-19 Task Force on Racial Health Disparities public hearing here in beautiful New Brunswick. And we're going to wait a few minutes to start. Welcome everybody in Zoom land, as well as everybody here. And if you can just be patient with us, as we all know, the weather's been a little bit bad. I want to say thank you to some folks here that drove up from South Jersey, North Jersey, all over Jersey. And so just bear with us and give us about 5 minutes or so before we start. Thank you very much.
Okay.
Hello, everybody. I know we're supposed to start at 10, but due to the rain and storm, we're going to wait just a little while longer before we get started. And again, this is Dr. Tanya from Roger Ashley. I'm calling you from Brunswick, New Jersey, beautiful Brunswick, New Jersey. And we're hosting the New Jersey COVID-19 Task Force on Racial and Health Disparities. Please come join us. You can join us either via Zoom or come over here in person. We're on the lecture. All right. We're at 30. I'm getting some help here. We're at 30 Van Dyke Street in beautiful New Brunswick, New Jersey. And we really just want to hear from you about your experiences with COVID or past your family and friends that experienced COVID or how COVID-19 has impacted you. So give us a few more minutes to let people come in and then we'll get started. Thank you very much for your attention.
Okay, we're ready.
All right. Good morning, everybody. We're going to get started. First, I'm going to put my glasses on. So, good morning for those in Zoom land, as well as here. This is the New Jersey COVID-19 Task Force on Racial and Health Disparities. We are hosting a public hearing at White Street in beautiful New Brunswick, New Jersey. There are wonderful people here. Come join us. And if you can't join us in person, join us in Zoom land. And so we're going to call this meeting to order. And we are now on the record. So, good morning, buenos dias, and in all of the beautiful languages we speak in the great state of New Jersey. Thank you and gracias. Hello, everyone. My name is Dr. Tanya Ashley. I'm the chair of the New Jersey COVID-19 Task Force on Racial and Health Disparities. I want to thank everybody who's here from the public for being here today on this rainy Saturday to share your stories about COVID-19, please. We also want to thank the Department of Children and Families for allowing the task force to use their training academy. But what a lovely place. Thank you so much. It's such wonderful people to greet us as we came in. We want to thank Ms. Jessica, I hope I say your last name correctly, Trombetta. Thank you. Ms. Jessica Trombetta, the Executive Director of the Office of Training and Professional Development for the New Jersey Department of Children and Families. And we also want to thank Heather Schwartz, the Facilities Manager, and her incredible team for making this camp so lovely. Facilities lovely, so clean. Everybody's so welcoming, and there's great parking outside. So it's a pleasure, indeed a pleasure to be back in New Brunswick. This time to hear about the challenges that we face concerning COVID-19, as well as successful collaborations to address them. Seated with me here are members of the task force, and some members may actually also be on Zoom. And I'm going to ask the members of the task force to please introduce themselves. We'll start with the head.
Good morning. My name is Donnelly Campbell Harrison. I'm an obstetrician gynecologist, and I work in North New Jersey. I'm also the president of the New Jersey Medical Association, which is an organization that represents color and work with health disparities. Local organization, chapter of the National Medical. Hi, my name is Dr. Jean Marie. I am the chair of the Graduate Studies programs at Brunswick.
Good morning, happy Saturday. My name is Nicole Prada. I work at the New Jersey Department of Children and Families under the Office of Equal Opportunity and Affirmative Action. And I'm so happy to be here.
Good morning, my name is Sarah. I'm from Alliance for Healthcare. I'm the CEO there and the co-chair of the task force.
Hi, good morning. My name is Amanda Foster. I'm the executive director for the Office of Occupational Health at the New Jersey Department of Health.
Hello, everyone. I'm Eric Dietmar. I'm the Director of Legislative and Regulatory Affairs at the Division of Consumer Affairs. It's great to be here with the Commission of Task Force.
So we're going background information on why we are here today. And then we'll briefly describe the purpose of the hearing and how your comments will be utilized. I can't tell you how important your comments are. Then there will be time for you to provide comments, and the task force members may have questions after your comments. At the end of the hearing, we will provide a brief closing statement. Okay, so a little bit of background on the task force. Task force was established pursuant to Public Law 2021, Chapter 106, on June 11, 2021, by our Governor Bill Murphy. The task force was convened June 2020. The task force is comprised of 23 members. We are charged with conducting a comprehensive study of how, I'm sorry, raise my voice up a little bit, forgive me. The task force is comprised of 23 members, some of whom are with us today. We are charged with conducting a comprehensive study of how and why the COVID-19 pandemic has disproportionately affected, impacted minorities and communities of color, marginalized and vulnerable in New Jersey, and to investigate the short and long consequences such as COVID. Though the task force is developing policy recommendations to address these issues, which it will report to the governor, the Commissioner of Health, and the legislature at the conclusion of the task force in March 2023, we are interested in hearing about the challenges New Jersey communities are facing and need to be addressed immediately, such as questions about access to services, vaccinations, COVID-19 medications, and more. Recently, a CDC study confirmed what we in New Jersey already knew, and what the task force and others in New Jersey have been talking about, communicating about, which is that people of color are less likely than white patients to receive COVID-19 treatments, such as Paxlovid and other medications. And this is based on a CDC study. Now, what's the purpose of this hearing? Well, the purpose is for the public to have a public comment period, to solicit and receive testimony from members of the state, minority, and communities of color, marginalized communities, based on their experiences with COVID-19. It could be that you had COVID, maybe someone in your family or a friend or you had COVID, and how it's impacted you. We want to take a moment to acknowledge and respect the great losses due to the COVID-19 pandemic, which are ongoing, and many who are struggling with the long-term effects of COVID, while recognizing access and services have been more challenging for some populations than others. We want to hear about these challenges, as well as how you may have overcome them, so we and others can learn from you and hopefully prevent them from continuing. Now, the procedure for making comments, the most important part is minute. As you come in, you are asked to sign in and indicate if you are speaking. If you have not already done so, we request, if you would like to make a statement, to please fill out the sign-in sheet and indicate if you wish to make a comment. Please let us know if you need an interpreter, and we will provide one. The interpreter will need you to speak a little more slowly and stop every so often, so they have time to interpret and share what you are saying correctly with others. We will then call upon you in the order that you signed up to
make a statement. To ensure that the hearing is conducted fairly, we will abide by the following additional rules. When your name is called, please come to the podium and state your name, correct spelling, any group or association you may be representing, and your municipality. Each person will have approximately 3 minutes to make a comment. This does not include time for interpreting. We will indicate when you have 30 seconds left. Please begin wrapping up your comments and then end within the allotted time. Speakers may have the opportunity to make additional comments after all other speakers have been heard. If anyone wants to submit written comments and has a copy with them, you may hand them to the persons walking around the room, or you may submit them through the task force website at www.nj.gov/health/NJCDTF, or by email to njcdtf@doh.nj.gov, or by mail at a later time. Written comments must be submitted by Friday, December 16, 2022. The mailing address can be found on the website. Please be courteous and respectful to one another. Only one speaker should be speaking at a time. Please do not interrupt the speaker. There will be no audio or visual presentations at the hearing. The hearing is being recorded, live streamed, and your comments will be a part of the information the task force considers in making its recommendations for the report to the governor, the commissioner, and the legislature. Let us begin. Dr. Pamela Brew. Hello, Dr. Brew. Did I say your name correctly? That's correct. Thank you. Thank you for coming here on this rainy Saturday. Thank you so much.
Thank you, and thank you for having me. And again, my name is Dr. Pamela Brew. I am representing President of the University of Washington Association. And in regard to our what we found and during this 2-3 years almost, and the fact that it has had I don't think that it's unknown to anyone that the greatest impact was felt by our community, and it came from the unequal access to healthcare, unequal access to services. There were insurance differences that made a difference. There was also lack of from the beginning of interpreters and changing to things, education to the Spanish language, our website, our apps, our registration form, etc. Even though we know that 26% of our residents are Spanish speaking. But most importantly, also noted that there was a lack of integration into the Black community. That it was a running, and what do we do? So we noted that as physicians, that the impact was greater on Black and brown people in our state. However, even within our state, there were these myths going around that we could not get COVID. And there was no the health information that was being sent out to our communities of color. And I would say that is one of the main problems that institutions either don't have engagement within our community. And I think that became a very important factor when we had to deal with not only discerning misinformation, but then getting people registered. You know, we all know how the registration was done first on the outskirts and then the broad finally into our community. One of the things that was done was, yes, a lot was done initially with the Black churches, but we also need to remember that for age groups 35 and under, many don't go to church, even in the Black community, which I think is a very church-going and mostly, Christian-led community. So, and all of those things led to us seeing more and more of the dying within the house. And it gave also the way we did it, assumptions were made in regards to it. And I think this still has to do with this. Like, who has access to the internet? Where is internet available free or of very low cost, right? I can't tell you what my bill costs, but we have high-speed internet, right? If those things, as you know, that our information technology is driving source for information, education, and many still don't have access to it. Quite as we found out during the pandemic. And I'm just speaking of this, I can't even say how behind times we are for and any other languages, even though we're doing the first state in the have not. So that's the problem that I still see that it's along with really real and parent engagement within our community. The other part.
I'm fine. I'll let you know.
Okay.
I'm sorry, I just put my hand up.
No, no,
But
no,
think
no.
that respectfully, you're absolutely fine. You're on a roll.
And so that comes in because now we are not only, we're dealing with the pandemic, but we still are behind in regards to vaccination, right? And now we're behind in all kinds of vaccinations. We're not just behind in COVID vaccination, but we're behind. We are also still needing to build trust within our community into the health system. And that needs to continue to be done. And one of the things that I think that needs to happen is that more the people that are actually doing the work within the communities that were hit harder by COVID need to have better funding and resources than what has been done during the last year. And it needs to continue because those are the trusted voices within the community. There has to be a way like people not having a 501(c)(3) or we organize the way that we think of as nonprofits. I think we have to start thinking outside of the box to really support and fund the people that are actually doing the work within our community and are trusted within our community. The other thing is in regards to having some type of system and process for information to get from the Department of Health or whoever is, God willing, I will never get pandemic again. But information that is related to health to get to the physicians who are actually working in those communities. One of the things that we asked early on, except for, the New Jersey Medical Association with Dr. Campbell, who knows what is the president of, where are the Black and Spanish-speaking physicians in the state of New Jersey? Because the majority of them work in the community that were being highly impacted by COVID. So we don't know that. And we tried to figure that out. And actually, we have a group of Rutgers students, the Warriors Grade, doing it manually, trying to figure out where the Black doctors are in the state of New York. There should be enough there, the technology there. There should be a way, a process where information gets to the physicians who are taking care of the communities that we want to reach. We as an association understand that we are part of that trusted community. And so many of us, we take the mantle upon ourselves doing different things, but there should be a way for the state to be able to organize so that that information process doesn't take place. And then looking at, I think it's important that we look at the diversification of our health care force and how people are taken care of. We see that health inequities or health disparities, however, whichever word you want to use, are improved, and some outcomes are improved when patients are taken care of by same rates or same providers. This is an unfortunate statement on its own, but it's the reality that we exist in. And so within the state of New Jersey, being so diverse, we must look at how do we diversify our healthcare force. And not only physicians, nurses, medical assistants. I mean, it goes from top to bottom, or side to side, however you want to look at, the care of the patient is not just the physician, right? So it has to do with everyone that actually touches that patient. So that healthcare force needs to be diversified, technicians, phlebotomists, sonographers, radiology, etc. But the point is that in this state, there needs to be a way to improve the pipeline of our healthcare force, and that we don't lose them to other states. And last, I want to say, there are tons of examples and stories you can give about that the resources and lack of connection to our community were really born even in communities that were predominantly white. The Black or the Spanish-speaking community lacked information, and they lacked the resources to get registered or to get vaccinated. Even in those. So, but I think also, if I look at this, I feel like I shouldn't be the only one up here. I should not be the only one up here speaking up. And so one of the things is, you know, I thank you for having this, but why here? Why in this location? I feel like we should be having this discussion in the heart of New Brunswick and Brunswick. Or, you know, or somewhere where people could walk to and get to and really explain and express their frustrations that they had during this pandemic. From getting the information, from getting tested, from getting registered, from getting the vaccine, and now even getting from the long, the real chronic effect that COVID has had. You know, and then we think about, you know, what is going on with the research, what impact will this have on the children from these communities, and what is being done right now for them. So I think that's an important takeaway, is to really, like I said, we have to be connected with the community. You know, we as an organization couldn't say, oh, yeah, we need registration. Let's figure out on paper how that's going to happen. You actually have to go into those communities and register people. Dr. Campbell was handing out that in Jersey City, you know, with educational information. You actually have to go and do the work in the community. That's what we want to do. That's what we believe we should be doing. But I think as a state, we should accept that this is part of our responsibility to take care of the most vulnerable communities and people that exist in those communities. Because as you see, we're not engaged when the pandemic happened. There was no roadmap.
Dr. Berg, take a deep breath because your testimony was so profound. It touched so many different areas. So I'm going to turn it over to the commission to see and others to see here, to see if they have any questions. But I just did say thank you. Thank you. Dr. Jamal, and all the other persons who mentioned with that
So, thank you again for your testimony. I'm the chairperson of the Communications Committee. So of course, I'm very much appreciative of your comments. And I wanted to ask a little bit more about, besides the boots on the ground. We two were out there, and I agree with you 100%. You didn't touch on literacy in addition to language, but some people wouldn't be able to fill out this registration form as well. They may not be able to maybe some suggestions as to how else you would think would be a good suggestion or plan for the state. I know from Motoras de Salud is one of the things that we definitely every, but I wanted to hear more from you.
So right at the top of my off the top of my head, one of the things I think that's very important is that we have to somehow have younger people involved in some of the communications answers. We have to look at, just like we're looking at diversifying the healthcare force, well, diversification of the marketing teams that exist or communication teams that exist within the state, I think is very important, because they know how they can reach their counterparts and their their friends and their families of their particular age. But I think using that, like one of the things that we did was one of the churches in my town actually had a group of young people that actually reached out to the elderly and the seniors in the town. And so everyone was assigned like a couple of seniors in the church to contact so that they could actually register them and deal with the click links of trying to be the fastest on the internet or et cetera. So, but a young person thought of that. They thought, oh, what can we do? How can we help? But one person had to help their grandmother, and they were like, oh, we can do this, or more than just my grandmother. So I think definitely getting them. I think the state is doing a better job of it, like, in regards to the diversification of the visuals that are seen. I think it's important, but I think still the language is still, I understand health and medicine and wellness is complicated in sometimes. And so there are a lot of words, right? And so how do you actually cut that in? I see, forget my grandkids, but even in my kids, you have to be able to hit them like quickly and get to the point, right? I could sit up here and tell you a story. They don't want to hear that. But so that's why I'm saying is the language of how to actually reach out to them is important, right? So I think that is one of the things that I would say is to look at not only within your communications, but within the departments all throughout the state and seeing who is actually heading those communications and marketing, I don't know what they're called, but the units, or who do they actually give, like as a consultant, right? Who do they hire? And are they reaching the people that we want them to reach, right? And does it make sense if we have I was working for someone and they had a consultant for 10 years. Why have a consultant for 10 years when they're not doing what you want them to do? Like they need to demonstrate that they're reaching the people that you want them to reach. I think that's important, but I think the out of the box way to reach people these days, it's going to need somebody younger than me. It really is. But I do see it as something that is very important in how we communicate, how we market, how we get information out. Like you said, health literacy. I was speaking to a group and they were telling me about the meta universe. And I'm just trying to get through Facebook, but anyway. I'm not Instagram, I'm not TikTok, but they were speaking about the meta universe like we were living in that actual world. And so, and they're like, yeah, Dr. Booth, you know, your organization can do this and this in the meta. And I'm looking at them like, they're talking in space in a foreign language to me. But I saw a demonstration of another platform that was like 3D and interactive, and you know, I was just blown away. I would have never come up with that.
I just want to say the same thing that my colleagues have said. It's just your testimony was so powerful. So a couple of things. You said your name, Dr. Pamela Brugge. So you were my doctor years ago, and you delivered my child. So thank you for that.
Wow.
So I'm just looking at you. I'm just like so overwhelmed right now. So I mean, it was a very difficult pregnancy. So I'm so appreciative of you. And then secondly, you talked about a couple of, well, a lot of different areas. Some of them have been brought to our attention, some of them have not. So I just wanted to reiterate access. So it's more than just communication. You said that people did not even have access to high-speed internet. We required people to register online. They did not have the ability to do that. And then sometimes when they may have had that ability, they didn't have the skills to go through the registration. I'm saying that because I had to register for my booster shots through CVS, and it was very challenging for me to get through that process. And then I did see some elderly people come to try to get the shot in person, and they were sent away because they had to register online. So that's very significant. You talk about the diversification of the healthcare system. I think that's so interesting. You talk about it though from the beginning. I said from the receptionist up to the physician level, which I thought was just so incredibly brilliant. And then I wanted to ask your recommendations about the approach. You mentioned there was a difference in the quality of healthcare, and that's why people did not have access to certain medications, or I guess I don't even know if that's the vaccines. But do you have any recommendations on how to approach that from, I guess, like, universal perspective to make it so everybody's eligible for whatever medications, whatever medications to come back when they do have COVID?
Yeah, so my thing with access and quality, so there are two different things, right? So I remember speaking to Dr. Campbell, and we were kind of kidding, but not kidding, how many people from my town were actually in Newark trying to get the vaccine or get tested, that have probably never been to the University Hospital area in Newark in their life. And it was amazing because I said, yeah, because if you look at our community Facebook page, it was that, hey, register here and you can get your test at that time or the vaccine eventually, right? But if you look at the community that surrounded the hospital, they weren't in line. So the information may not have been getting to them, or it may not be registering with them, or whoever was, maybe the person that was giving the information was not the correct person to be giving the information, right? So, because they actually could have just walked down the street and got to the university hospital, so, you know. But there's always quality of care conditions, quality of care concerns that we have. because we know that even though you step into the healthcare system, you may be treated differently because of who you are, what color your skin is, what your immigration status is, what language you speak. Okay? And those things need to be changed on a systemic level. It has to be in my opinion, a forced change. We have to somehow figure out what it takes. Like implicit bias training on its own is a checkup box. It's not the solution. Even though we have penned it as the solution, it's not. We already seen it, there are plenty of studies to show that it's the bare minimum and that's it. But what is it that will actually make the difference in the healthcare field that is going to change the health outcomes? Or in New Jersey, you know, if you add up all the different races, we're greater than 50%. Okay? Of our state. So what is it? But that takes research, right? But that's not the kind of research that people fund, right? Just think about that. So what can change that? Because you have to have the research to figure out what it actually is going to change, except rules and regulation, and there has to be consequences and impact, and most of the time dealing probably monetary impact to make those changes. But what is it really going to change their mindset, to change it, for people to take a step back to say, whoa, I'm doing something that I should not be doing based on the person's X, Y, or Z, right? I can say that early on, when we had problems getting tested, I had two colleagues, one a white male, one a black female, who had COVID. Or they thought, right? They had the symptoms. They went to the same urgent care center. One's family got tested, the other one was sent home. I don't think I need to tell you which ones got sent home.
Thank you so much. I could listen to you all day, truly, because you really speak to me. I'd like to also talk about the Hispanic community. And the Hispanic community suffered tremendously, not only because of the language barrier, but because of their immigration status. So it kept a lot of them away from getting whatever they needed done. And then while they were fearful, all the misinformation got ahead of them because things weren't translated, they weren't educated properly, not quick enough. So the misinformation got a hold of us before we could even come at it. And I like that you said you have to find somebody to get that messaging across in terms that everybody understands and get it there quickly. Now we're in the second phase or third phase. I don't know what phase we are in right now, this pandemic, but I appreciate you in crystallizing all this information to us and from your lens, because you see what I see, and I appreciate everything you have to say, and not only telling us the problem, but giving us some ideas for some solutions. So thank you, Dr.
I think thank you so much for the kind word. I think one of the things that we found in New Brunswick, we actually work with the Board of Education and the school system. So once a month, we hold in one of the schools a vaccination clinic. And we also have done panels education in both English and Spanish on their website, where it gives information about COVID and the vaccination. I think they call it Parents University. So I think what you need to do, the school system, as I clearly saw there, because of who they had in their school system, were felt to be a safe place. And so when we opened up that first vaccination, I know Dr. Cameron shaking her head, people were standing around the court, out the door. Oh my gosh, and coming, bringing their family members, even from other towns, to get vaccinated or tested. And to this day, we still hold once a month the same vaccination clinic. So I think and we try to also do other wellness and health information at those clinics. But I think it's finding who is the trusted source in the community, and making sure that they are part of the solution.
Thank you, Dr. Bruce, for letting me drag you here on this rainy Saturday. I just wanted to elevate a couple of points that you brought up, specifically to just delve in a little bit more from your perspective, because you speak to a lot of physicians. So, and you spoke about the fact that is well known. Physicians of color tend to work in underserved communities. They tend to work in communities where patients have no insurance or are underinsured. So how can you tell us a little bit from your experience in speaking to physicians? Were physicians feeling supported? And is there something that this committee and that we can recommend to the state in terms of helping to support physicians? I know we have our own Dr. Ortiz, who's on this committee as well, who talks about the lack of primary care physicians, but do you have any suggestions on that?
Yeah, so I would definitely say I don't think our physicians felt supported. I think they felt overwhelmed and they felt isolated. And I think that's also very important in trying to figure out who are the Black or Spanish speaking physicians in the state, because you can formulate a network of support if you know who everyone is. But they definitely felt, I think, isolated and not supported, and just totally overwhelmed with the impact that they were seeing to not only their patients, but to family members, right? I mean, I had one aunt die, 3 cousins died from COVID, right? So it's not just you as a professional, but you as we are part of our community. So I think one of the things is that once you are able to, the physicians who work in these communities can actually let you know about what resources are lacking, right? What resources are lacking to help to make, we all know that, or I shouldn't say we all, but wellness and health is determined basically by the social determinants of health, and not necessarily by the caregiver. So the social determinants of health, which you have to deal with where you live, transportation, education, health access and quality of care, all have an impact on your health. And so what happens is, where do those physicians actually get to know where they can find the support in real time to help the patients that they need? I think it's very important. I also think that we really have to look and see how we've developed our healthcare system is still a deal with the diseases type of healthcare system and not a preventive healthcare system. And so we are losing a lot of primary care physicians to retirement, where we are not replacing them. One in part is the cost of becoming a physician. If you are, I look at my students and I don't even know how they do it. If you're coming out at $250,000 to $300,000 in debt, you're not going to necessarily look at a primary care field, which is going to pay you, even though it may be more than most people, but it's not going to pay you above $100,000 or minimum close to $100,000. They're just not going to do it. And then you have to remember, we're also dealing with a different generation. They're not going to do it. So how do we, first of all, support so that more people would want to go into a primary care field? And then you have to look at education, cost reduction, incentivizing people to go into the primary care field. And I think that's not just in the medical field. So it's not only in the physician side, right? You also have nursing having the same problem also. So you need to figure out, how do you create a health force, diversify it, but incentivize so that you actually deal with the importance of preventive care and primary care more than dealing with diseases.
So, Dr. Bruce, one more thing I wanted to bring up. You mentioned, actually two more things, but the next thing I wanted to bring up was just, you mentioned folks not having access to internet or high-speed internet. And some of the work, you said I did it, but there was many people who were boots on the ground. I wanted you to talk a little bit about the development of the educational materials and how even in the last 6 months, you have run out of those educational materials that we hand out at community fairs. There seems to be a desire and a need for people to have information. And you can talk a little bit.
So one of the things that we actually we started the association because we wanted to deal with the horrible statistics regarding Black pregnant persons, where they are dying at a rate 7 times that of their white counterparts. And that's why we actually started the association, and we are in the executive branch or OBGYNs. But when we started just before COVID, and then COVID hit. And so one of the things that we were looking and concerned about was getting the information to Black pregnant persons and seeing and actually understanding that usually women are the health educators and caregivers of their families. And so if we could reach them, they would in turn reach the rest of their family. And so we developed the New Jersey Black Women with the NMA and Planned Parenthood, basically a handbook that went into what was COVID,
What can you do? What are the symptoms to look for? What sends you to the hospital? What can you do if you just have mild symptoms? How do you take care of yourself in this whole pandemic world? And that handbook was with other things, were with masks and vitamin C and all those kind of things, were actually given out to some of the FQHCs in the state where we saw had hit the COVID had hit them the most. Then we said, well, you know, we're going to food lines, we're going into different community areas, and people were looking for information that they actually could take with them. So we developed so basically a postcard that has the information, and it speaks on both from an adult point of view, in the back speaks on in regards to children and how to deal with children during this COVID world. And then we had that translated into Spanish because we were going between the Black community and the Spanish-speaking community in regards to the work that we were doing. And you know, we luckily were, at that time, we were able to develop those from a grant that the state had handed out. But I know funding has basically dried up. And now we are again, you know, same thing. We're still doing those community events, and people are still looking for information. So we are always, if any of you know of a grant that we could apply for, or where we can get funding to continue to develop our educational materials that we can just easily hand out while we are there. You know, I think the good thing about us being in those places is that people can just ask us questions, right? And they can speak to us. My Spanish is, but I do try and I'm able to communicate. But most of the time, if we're in the Spanish community, we definitely have, like if we're in New Brunswick, you know, a lot of the schools administrators and nurses are you know, some are Spanish speaking. So we always have someone, but I think they get a kick out of me trying to speak Spanish.
The last thing I wanted to just elevate, as I like to do at every hearing, is pregnant people as a vulnerable population. I believe that pregnant women are not vaccinated at the same rate as the general population, and they certainly do not receive medications at the same rate as the general population. And I wonder if you could offer any, from my own practice, when I ask patients, you know, why they haven't gotten a vaccination or why they self-diagnose themselves at COVID and stayed at home and didn't come to the hospital to get evaluated. Lack of knowledge is one, not certain of the safety. Is there anything insurance companies can do to help provide anticipatory guidance to our pregnant and postpartum population to let them know that it has been approved and it is recommended by many different organizations? And I just want to, before you know, from my own experience as an obstetrician gynecologist, just happened to me this week, because we do give vaccinations in pregnancy. We give two vaccinations in pregnancy routinely: the Tdap vaccination for whooping cough and the influenza vaccination. And in my own facility, the Tdap vaccination and the whooping cough vaccination, the Tdap vaccination and the influenza vaccination, which is seasonal, of course, we give it in our OBGYN clinic. So when I counsel to the patient, if they agree to get the vaccination, they can stick out their arm right there in my office and get the vaccination. But with the COVID vaccination, unfortunately, they have to go somewhere else. It puzzles me. I don't understand because I can tell a woman, these are the vaccinations that I recommend: COVID, influenza, Tdap. They will stick their arm out. They will get Tdap. They will get influenza. They may not get it on the same day, even though I tell them it's fine for them to do so. But when I have to send them upstairs to a different floor to get the COVID vaccination, and they come back at that next visit, it's not done.
Yeah, so, just for transparency's sake, in my other job, I am a medical director at Horizon Blue Cross Blue Shield. I'll answer the insurance part first. Here in the state of New Jersey, if you don't have insurance, you can qualify when you're pregnant for Medicaid if you fulfill certain criteria. So depending on, it may be federal, and we can get that for, at least for the pregnancy, but that money runs out kind of quickly in the state of New Jersey. So it does leave a group of pregnant persons without insurance, even in the state of New Jersey. For those that do qualify for state Medicaid, most of them do go into one of the MCOs, basically managed care organizations, where Horizon is one of them. And be clear, I'm not speaking on behalf of Horizon for sure. I am speaking on my own behalf. But yes, there are things to do, right? One of the things is, once a person is identified as being pregnant, right, education needs to start. Like, so most of the plans have case management programs. So what the thing is that they have to start, you can't say once you're in the third trimester, it needs to be education that's ongoing, so that hopefully they're getting the information from whoever is their provider, and at the same time, they can get it from their case manager, from the insurance company, saying, yes, this is something that's recommended for you while you are pregnant. And also, if you have COVID and you have symptoms and you're pregnant, get to the hospital, because you could actually end up with severe disease, right? I think people are these days very like, oh, COVID is flu, but flu kills pregnant persons also. And so it isn't just having the flu, because the flu can kill you too when you're pregnant. But that, I think, is the most important thing. And every insurance, at least the Medicaid ones, are, governed somehow under Medicaid office to say, hey, what initiatives are you doing to reach more of your pregnant persons, especially all over, but especially in X, Y, and Z communities, and how are you reaching them, and what has the effectiveness been, what are the outcomes have been, etc. What are your rates of immunization? What are you doing to improve the immunization rate? What are you doing that your members can have telemedicine visits? How can they get the whatever is needed for your telemedicine? Do you provide them with urine dipsticks? Do you provide them with a blood pressure cuff? Do you provide them with a scale? what are you doing to allow them to have an appropriate quality of care kind of telemedicine visit?
Dr. Booth, thank you so much. You've been saying for, oh, can you hear me now? Sorry, I sound like a Verizon commercial. No, I'm not. I want to say thank you. You've been standing for a very long time and have been educating us. And just want to say how much we appreciate it. And I can assure you that the time spent with us, that we will have it will document what you have said and your recommendation, and hopefully bring them to fruition. And thank you for all you do in our community. Thank you for coming here today. For building people like our colleague right here, I know I did. Thank you, have a wonderful day. I appreciate it.
Thank you, but do realize that it's not just me. I think we have a whole force of people behind us at all times that we can call up and say, hey, we need you here and there. I have to thank them for everything they've done. And I know Dr. Campbell, she's a force to be reckoned with. And
Absolutely.
and so she helps to sustain me. So I thank you. Thank you again.
Hi, we're going to take a break for until we get another speaker. Thank you very much.
Hello, everybody. Welcome back to the New Jersey COVID-19 Task Force on Racial and Health Disparities. We're going to be wrapping up. And before I even speak, what we're going to do is have the interpreters come up and share in several different languages when the virtual hearing will be the time, the virtual hearing, which is going to be on December 6th, I'll be announcing in a moment. And also they're going to speak in different languages about how people can provide public comments. And I can't say this enough, public comments are due on December 16th. You can provide public comments via email, you can write in your public comments. But we're going to have the interpreters come up one by one. They will introduce themselves and they will say what language they're going to be speaking in. Again, to share with you the information on how to join us for the virtual public hearing on December 6th, and also how to provide public comments by December 16th. With that, we'll begin with the first interpreter. And I really want to thank our interpreters. They're amazing people, doing an amazing job.
大家好，我係廣東話翻譯。今日新澤西州嘅嗰個工作小組咧，係關於新冠疫情對於種族以及社區健康方面嘅一啲差距，舉行咗一個公眾嘅聽證會。下一次嘅聽證會咧，將會係星期二12月6號晏晝4點半到晚上8點舉行嘅。嗰次嘅聽證會咧係喺視頻上通過 Zoom 舉行。喺呢個聽證會上面咧，大家可以講你哋嘅意見，關於疫情對你哋影響嘅意見。另外咧，喺10月16號之前咧，社區各位都可以向呢個工作小組遞交你嘅意見嘅，點樣令政府做得更好。咁樣呢個意見咧必須係書面嘅，你可以寄嚟咧，亦可以上佢哋嘅網站遞交嘅。佢哋嘅網站嘅網址係 www.nj1.gov 前槓，然後 HEALTH 前槓，然後係 NJCDTF 再一前槓嘅。大家好，我是普通話翻譯員。今天新澤西州的特殊的工作小組關於新冠疫情對於種族以及我們治療方面、社區治療方面帶來的差距呢，舉行了公眾的聽證會。如果你今天不能參加的話呢，下次的公眾的聽證會還會舉行，日期是星期二12月6號下午4點半到8點。那一次的會議呢是會在 Zoom 舉行的，歡迎大家參加，告訴政府在疫情中您的受到的困難，還有怎麼成功的克服了那些困難，告訴政府如何下一次做得更好。另外呢，在政府也歡迎大家的遞交給政府公眾的意見。那麼遞交的意見呢，需要在12月16號之前以書面的形式遞交，你可以郵寄過來或者上他們的網站遞交您的意見。他們的網站是 www.nj.gov/health 就是 HEALTH/NJCDTF/記住那個截止日期是12月16號。好，謝謝大家。
Thank you.
Ok, muy bien, gracias a todos. La siguiente audiencia virtual para el público se llevará a cabo el día martes 6 de diciembre de 4:30 de la tarde a 8 de la noche. Se llevará a cabo a través de Zoom, la plataforma Zoom. Comentarios del público tendrán que ser ingresados a más tardar hasta o más tardar el 16 de diciembre. Puede ser hecho por correo electrónico o al sitio web ingresando a www.health.gov/NJCDF/comentarios hasta el 16 de diciembre. Gracias.
નમસ્તે તમને લોકોને ફરીથી હું ગુજરાતીમાં આ વિશે સમજાવી દઉં છું કે હવે 6 ડિસેમ્બર એટલે કે મંગળવારે બપોરના 4:30 થી રાતના 8 વાગ્યા સુધી આવી જ જાતની સુનાવણી જનતા માટે થશે. ફક્ત એ ઝૂમ ઉપર થવાની છે અને એ વિશે તમારે જો વધારે માહિતી જોઈતી હોય તો અમારા વેબસાઇટ પર જશો તો તમને બધી ખબર પડશે અને તમને આમંત્રણ આપીએ છીએ કે તમે આમાં ભાગ લેજો. આ સિવાય જો તમારે કોઈ જાતની પ્રતિક્રિયા મોકલાવી હોય તો તમે મેલ દ્વારા પણ મોકલાવી શકો છો અને આ લોકોને આ વેબસાઇટ પર પણ મોકલાવી શકો છો. ફક્ત એટલું યાદ રાખજો કે ડિસેમ્બરની 16 તારીખ સુધીમાં તમારી પ્રતિક્રિયા અમને મળી જવી જોઈએ. તો હવે હું તમને આ વિશે વેબસાઇટ પણ જણાવી દઉં છું કે જ્યાં તમે જઈને બધી માહિતી અને પ્રતિક્રિયા મોકલાવી શકો. તે છે www.nj/gov લખવાનું, પછી સ્લેશ, પછી HEALTH લખવાનું, પછી સ્લેશ લખવાનો, પછી NJCDTF અને ફરીથી એક સ્લેશ લખવાનો. તો આના ઉપર તમે જજો, બધી માહિતી મેળવજો અને તમારી પ્રતિક્રિયા જરૂરથી આપજો. ધન્યવાદ.
Thank you very much. Yeah, that's it. Sorry about that. Thank you very much to all of our interpreters, including the sign language interpreters who are to the side of me. Thank you today for all of your comments and your cooperation. We appreciate your interest in the New Jersey COVID-19 Disease 2009 Pandemic Task Force on Racial and Health Disparities and the time you took to be here and share your valuable input. As a reminder, and as you just heard from our interpreters, the public comment period closes Friday, December 16, 2002. The task force will hold a virtual hearing on Tuesday, December 6th from 4:30 p.m. to 8 p.m. And that's virtual. Again, that's a virtual hearing. And the task force wants to remind the public that the pandemic is not over. Please, the pandemic is not over. Please take protective measures in your daily lives. It's still very important. This includes wearing masks in public, social distancing, getting vaccinated. Please get vaccinated. Not only for COVID, but for influenza and, if appropriate, pneumonia. COVID-19 vaccination starts at 6 months of age, and staying up to date with vaccine boosters is very, very, very important. If you have been exposed to COVID-19 and or have symptoms, please get tested. If you test positive for COVID-19, there are medicines which may be helpful to you, but they must be taken within 5 days of testing positive, such as Paxlovid or mononuclear antibodies and remdesivir and other medications. We want to remind everyone that it is flu season, so please, when you go for your COVID-19 vaccine, also consider getting the flu vaccine. That's how I did it. I got my COVID-19 updated booster and influenza booster together. Also, New Jersey has a wonderful website. I use it almost every day. It is the New Jersey COVID-19 Information Hub, and you can find it at https://covid19.nj.gov/ with wonderful resources in many different languages. You can also call COVID-19 vaccination and testing for information about that. Call 1-855-568-0545. Get a safe again. If you have questions about COVID-19 vaccination and testing,
please call 1-855-568-0545 where people can speak to you in many different languages. If you have medical COVID-19 questions, we have another telephone number for you, which is 1-800-962-1253. There you'll be able to get medical information from a healthcare professional on symptoms, when to seek medical attention, and proper steps to take if you're exposed to COVID-19. Again, if you have medical COVID-19 questions, please call 1-800-962-1253 for medical information from healthcare professionals on symptoms, when to seek medical attention, and proper steps to take if exposed to COVID-19. The hearing is now closed. Thank you, gracias, and all the beautiful